You guys might have to sign off on a disclaimer to post this.
Alright, my name is Jamie McConnell, and today I'm going to be presenting on CT colonography versus barium enema. Okay, so my actual article title, I didn't want to make that my title of my PowerPoint because that is too much. But it's basically just saying that it's CT versus barium enema, and kind of goes over how it best could detect large polyps or colon cancer. So to start, there's several procedures available to investigate patients with colorectal cancer. Barium enema is the most established just because it's the oldest, and it's kind of like, you know, the older doctors like to stick with what they know, even though it's absolutely terrible for the patients. A little background, so CTC, or computed tomography colonography, it's basically a virtual colonoscopy. So these are some images of it. It's really cool looking. It's a relatively new technique. It's kind of replacing barium enemas because it's a lot easier for the patient, and obviously they prefer it. And it's used as a screening test, and it's a lot higher sensitivity, so it's better at detecting the polyps, and I'll get a little bit more into that. The objective of the study is to compare CTC with BE, barium enema, in terms of diagnostic accuracy, image quality, and what's optimal for the patient. So the presenting symptoms, this study isn't really, I know it said that it can be used as a screening, but this study really isn't for patients that are screening. It's more for patients that are having problems currently. So if they have change in bowel habit, abdominal pain, rectal bleeding. So the methods of the study, the participants had to be 55 years or older. They had to be fit to undergo the bowel prep, because that's pretty much the worst part. They can't have any history of cancers, no history of inflammatory bowel disease, and they can't have had any kind of other colon examination within 6 months. So they can't have already had a colonoscopy or anything like that. How they selected who would have what was completely random. They kind of just had the computer randomly generate it. You would go here, you would go here, you know, to go for BE or CTC. So the barium enema, you have to have full bowel prep, which is you have to drink the Go Lightly, which is like a huge jug of nasty, and you drink it over like 8 ounces every 30 minutes or so until you finished it. It's an entire gallon. And then depending on what other pathologies you have going on, you may have to do further preps. You may have to drink the, it's like a fizzy drink, and it kind of, same thing, cleans you out. And then, like I said, depending on how bad your pathology is, you may have to do enemas, like water enemas or saline enemas to further clean you out. And then with the barium enema, I'm sure y'all have all done barium enemas. We're going to inject the tip into the rectum, and we're going to fill the bowel up with barium. That's this right here. And then you can see that it's really inflated because we're also going to use air as the negative contrast. And that's going to really open up the bowel so you can really see any kind of polyps or anything going on. Those images will all be taken under fluoroscopic, like the fluoro tower. And so those are kind of like a live feed images. And then to follow, we'll also do decubitus films, and then depending on where you work, you may have to do 1,000,001 images as well. But the decube images are just going to show all the different size, show air fluid levels, stuff like that. So then the methods for the CTC, so you also have to have full bowel prep. I don't think it's near as involved though. You're still going to get the gas insufflation, except for we're going to be using the multi-detector row scanners. And same thing, depending on the facility, they may scan you supine and prone just to get better images. So the interpretation of the study, 82 practitioners, which these were all radiologists, interpreted the BE studies, and 39 radiologists interpreted the CTC studies. It didn't say why so many less interpreted the BE studies, but that was definitely kind of a limitation of it. Like almost half as less interpreted the CTC over the BE studies. And then it just kind of threw in there that they were all familiar with interpreting these procedures. It wasn't like their first time. And they had read over 100 cases, and if they hadn't read over 100 cases, then they had to do supplementary educational courses to make sure they were really on top of it. So the results of 2,527 patients assigned to BEs, 141 were diagnosed with colorectal cancer or large polyps. This is a picture of a large polyp. I didn't really know what a large polyp looked like, but I thought that was kind of cool. And then of 1,277 patients assigned to CTC, 93 were diagnosed with colorectal cancer. So you can tell a lot higher percentage were diagnosed through CTC than they were for BEs. And once again, I don't know why there's so many more people that did BEs over colorectal cancer. It did not include that in the study. So the results, based on the data, the detection rate of cancer and polyps was much higher for CTC than for BE. The relative detection rates differ significantly by age. So in younger patients, the rate after CTC was double that of BE, which just makes sense. Not a lot of younger people develop colon cancer. It's much higher in the older population. And it just said that the rates were similar the older they got. So consistent with the higher sensitivity, CTC missed fewer colorectal cancers than BE. So compared, BE missed 7% versus, other way around. CTC missed 7% versus BE missed 14%. So it's a big difference. The potential advantage of CTC is that patients can have a colonoscopy on the same day. So if they go in, they do the CTC, they see a polyp or something that they want to biopsy, they can go ahead and still have the colonoscopy, which is nice. So in conclusion, CTC is much more sensitive than BE for detection of colorectal cancer or large polyps. The higher sensitivity is ideal in detecting small polyps. And results conclude CTC should now replace BE as the preferred method for radiological tests for patients with symptoms suggestive of colorectal cancer. And I think the patients would agree. And my references, and that's it.
Should we make it a 10?